Hello everyone and welcome to today's presentation. We're going to be talking about welding fumes, the health hazards and exposure prevention of them. I'm here with Masood Ahmed and Sonia, and we are your presenters today. So just an outline of what we're going to talk about today. We're going to tell you who OCAL is and what we do. We're going to go in an overview of the workforce of who works with welding. We're going to talk about the basics of welding and welding fumes. We're going to talk about the chemical composition of welding fumes, the size fraction of the particulate matter. We're going to talk about the health hazards and medical surveillance. We're going to review what the occupational exposure limits are, and we're going to look at specific contaminants such as manganese, hexchrome, nickel, iron, and beryllium. And then we're going to conclude with welding exposure prevention strategies. So a little bit about OCAL and who we are. Throughout the province, we have 7 clinics: Hamilton, Toronto, Windsor, Sudbury, Sarnia, Thunder Bay, and Ottawa. So from these 7 clinics, we cover the entire province of Ontario. So the Occupational Health Clinics for Ontario Workers, or OCAL for short, is what we like to call ourselves. At each clinic, we have a multidisciplinary occupational health team. It consists of client service coordinators, occupational physicians, occupational nurses, ergonomists, and occupational hygienists such as Sonia, Masood, and I. So what do we do at each clinic? Well, we have a medical diagnosis service. This is where we see individual workers who have been denied compensation claims, and we help them with the medical part of their claim. A group service, this is where we actually go to workplaces and we mostly work with joint health and safety committees on any industrial hygiene or ergonomic issues. We have an inquiry service where anyone can call us and ask us any health and safety issue, and we'll try and help them best we can. We do outreach and education, such as this presentation, and when we're not doing those 4 things, we do a little bit of research on the side, along with intake clinics. And this is where we see a group of workers from the same workplace or have similar exposures. So again, just a review of our services. We have individual clients. We answer work-related health questions, informational presentations, workplace visits, and as I mentioned, requested by the co-chairs of the Joint Health and Safety Committee. This keeps us unique from other health and safety associations. And here we are with our intake clinics for medical, industrial hygiene, and ergonomic, possibly combined, and research projects. All right, I'm going to pass it over to Masood for the next section.
Thanks, James. Before getting into some technical details about welding fume exposure and other things, I would just want to highlight the fact that how big is the workforce when we talk about workers being exposed to welding fumes. International Agency for Research on Cancer has done a study in 2017, and they reported that there are 11 million workers who are directly exposed to welding fumes, and there are 110 million workers who are indirectly exposed to the welding fumes. And they also report that this could be a well underestimation of the actual numbers, because in many countries there is no robust mechanism to collect data on registered welders. As far as North America is concerned, there are 754,000 welders only in USA, and approximately 1 million in North America. So that leaves Canada with approximately 250,000 welders. Next, please. A Canadian organization called CRSP, carcinogen exposure. They collect data on exposure on different carcinogens, and they collect data on how many workers are exposed. And they have reported on their website that there are 333,000 workers who are exposed to welding fumes in Canada in different industries. And they have also stratified number of workers in different industry, mainly manufacturing and construction. Next, please. And this slide shows the number of workers exposed to welding fumes in different provinces. The leading province is Ontario, of course, because of the large workforce, followed by Alberta, Saskatchewan, Quebec, and other provinces. Next slide, please. IARC has also done some study to see how many workers are exposed in low, moderate, or high categories. These categories are made based on the frequency of exposure. And what's important to note here is that 60% of workers who are exposed to welding fumes are in the high category. And if we combine moderate and high, it makes 91% of the workforce who are exposed to high levels of welding fume, which is quite concerning. Next slide, please. Occupational Research Cancer Center has done a study, and they have calculated the burden of occupational cancers on the health systems, and they have reported that there are 310 lung cancers and 15 ocular melanomas been reported from occupational exposures, which are 1.3% of the total lung cancers and 5.4% of the ocular melanomas. And each lung cancer can cost about $308 million in 2011. So in today's, in terms of today's dollars, it would be a much higher cost. Next slide, please. So welding is basically is a process to fuse two metals by heating the metals either through an electric arc or by using a gas. So it's a simple technique by using a heat source and a filler in some instances. Next slide, please. So based on the source of the heat, that is arc or gas, we can classify welding techniques, broadly classify welding techniques into gas welding and arc welding. And then arc welding is then further divided into different kinds based on what type of filler material is used. You can take a pause and look at this chart to if you're interested in looking at different kinds. Next slide, please. So I think it's important to mention briefly what are the different elements in one of the most hazardous kind of welding, that is stainless steel welding and mild steel welding. So in stainless steel, we have predominantly we have chromium and nickel, which both are lung carcinogen. And in mild steel, we have manganese and silicon. And in general, in any kind of welding technique, we have exposure to welding fumes and particulate. I want to emphasize that we should not put too much effort into differentiating between different kind of exposures within the complex welding fume exposure, because the IARC has classified welding fume as a lung carcinogen based on the total exposure, not based on one metal or the other. Next slide, please. Here's a nice table on the type of welding and what are the corresponding exposure to that type of welding, and what in what common industries that kind of welding would be used. So the most widely type of metal welded is stainless steel and mild steel and galvanized steel, and mostly they're used in manufacturing, variety of different kind of manufacturing, and then mostly it is done through stick welding or manual arc welding or flux core arc welding. Next slide, please. Again, this table shows the proportion of welders who are using what type of welding and what type of metal being welded by welders. As I said, stainless steel and mild steel and galvanized is the most common type of metals welded, and stick welding or flux core welding is the most common type of welding used. Next slide, please.
Thank you.
So, Sonia, over to you, I think.
Yes, thanks. So what are welding fumes? These are produced when metals are heated above their melting point. They vaporize and condense into fumes. So this is a good visual just to give you an idea of the entire circumference in the beige is the size of human hair, if you will, under a microscope. The welding particle you can see is smaller than a dust particle. And in these cases, when we talk about exposures, size does matter because depending on how small the particle is, that's how deep it can penetrate within the respiratory system and cause damage and or the onset of disease. So let's take a look at the next slide, please. So here, this just gives you an idea of what I was speaking to in terms of deposition of the contaminants into our respiratory system. The nose, pharynx, mouth, and larynx area, the extrathoracic area, if you will, is the area where larger particles can be expelled. We sneeze, we cough them out. If the particles are smaller in size, which is depicted in the chart to the right, the smaller the diameter of the particles, the more deeply they can be penetrated into our respiratory system because we don't have the correct mechanism to expel them out. They're too small. And so when they do deposit deeper into the respiratory system, long-term diseases such as lung cancer, COPD, for example, we're going to get into this into the next few slides. Those types of diseases can develop because once these particles get in, they don't come out. Next, please. So welding fume generation, if you look at this in terms of which processes expel the most fume versus the others, in decreasing order, you have, as Masood has already mentioned, the flux core arc welding. And then as you keep going down, it's the TIG welding that has the least amount of fume generation. So this is a good slide to refer back to. Next slide. So how do we determine the extent of exposure when we're trying to assess an individual or a group of individuals with regards to welding? Certain things, some key items to be looking at is, as you've already seen, the type of gas used for welding. So what products are used for the welding process itself and what is being welded. So the welding rod materials, the base metal being welded, metallic or paint coatings. Now, this might all seem very theoretical, but if you're thinking about welding on items that have already existed, let's say a machine or a device, and you're welding now on top of that, that machine or device has collected things on it over time. This paint is an issue. It might have been painted over several times, so definitely there'd be different products. And so whatever's being welded or heated is going to then be part of the exposure plume, if you will. Then, of course, the welding process, and if you have ventilation or some sort of controls present while you're doing the welding. So these are some of the key things to be looking at when you're trying to determine the extent of exposure. Next, please. So you pretty much have a chemical soup when you're looking at the composition of weld fume, again, depending on the couple of things that we've spoken about. And this is just a snapshot of one typical scenario on a given day. You could have lead oxide, iron oxide, phosgene, all these different contaminants, some of which are deadly carcinogenic, if you will, and some remain to be determined if they are. And this all depends on, again, like we talked about, what you're welding, how you're welding, and what the state of the product that you're welding on is in or has been in. Next. So just to break it down a little further, you take that chemical soup and you break it down. You have particulate matter and you have gases, which is the majority of the fume composition. Again, a good landing slide for you to go back to. I won't get into this in any detail, but I think you get the message that welding fumes aren't simple. There's a lot in their composition. Next. So some other things to consider when looking at the factors affecting exposure is also type of welding process, base metal and filler metals that are used. We mentioned this already, the welding rod composition, shielding gas ratio. I touched on this a bit, the use of ventilation controls or the misuse or the lack thereof, the degree of enclosure. So this all goes with controls, with which James is going to speak about in the couple of slides to come, air movement in the space that you're in, and the current and voltage that you're using. So these all also affect the exposure if you're looking at the exposures for welding. Next. And also the work practices of the welder are also very important. Are they using the proper personal protective equipment? Have they been properly fitted? Do they know how to use the equipment? What is the position of the welder in reference to the fume that is created, or the plume, if you will, that is created while they're welding? And what is the position, or how is the air moving in that particular area? So it's kind of an artistic picture that's created, but if you can get this right, then the exposures can be either heightened or lessened if you're studying this properly. Surface cleaning, and as already mentioned, working upwind when welding outdoors. And this can happen indoors as well if you have a draft situation in the workplace. Next, please. So let's get into welding fume exposures and health effects, because that's what we want to ensure that we're protecting our workers when they're welding. And given the stats, we know that we need to spend more time here in protecting our workers. So we need to be looking at the fumes, the gases, and the vapors. Next. Masood?
Thanks, Sonia. So we can broadly classify health effects into acute and chronic. And acutely, welding exposure can cause eye, nose, and throat irritation, and it also can cause dizziness and nausea. On chronic effects, it can cause cataracts from UV exposure from welding fumes during the welding operations, and it can also cause chronic obstructive pulmonary disease, and more dangerously, it can cause cancer if one has been exposed to welding fumes over a number of years. Next, please. Now, the big question about health effects from welding fume is that should we do medical surveillance or not? Medical surveillance is not required by law in Ontario because this is not a designated substance. So we don't know what tests to run and what symptoms to look for to do the surveillance. But we can do, blood and urine tests to see how much one has been exposed to, different metals in the welding. Next, please. So for medical surveillance, one can do, for instance, chest X-rays or CT scans, but one will have to look at the pros and cons of both of the techniques. So lung cancer is not considered as a very good test to detect for a cancer, let's say. And it can miss the cancer, and we don't really know how often one should go through the X-rays, like 6 months or 1 year or every 2 years. We don't know. It all depends the particular circumstances of a worker's exposure. CT scan is a good tool, is a good test to detect cancer at an early stage, but it has a high radiation dose delivered to a person. So we really have to, do a risk versus benefit analysis, see if it really, will benefit a worker to do CT scan, and to do the risk and versus benefit analysis, one will have to look at the non-occupational risk factors too. Next slide. Now, how we can do biomonitoring? Biomonitoring can be done for specific metals like nickel, chromium, and others. And the commonly used biomedia are blood and urine. One would have to follow the guidelines from let's say ACGIH, who has laid down all the different criteria for what to sample, when to sample, and how to sample. It should be noted that the presence of a metal or its metabolite in the blood or urine only confirms the exposure, and that's true for all the biological exposure indices, that it only corresponds to the exposure. It doesn't tell you anything about the progression of a disease or the likelihood of a disease to develop in the future. So one can do the sampling and compare it with the BEIs, but not to check for a disease. Next slide, please. So we are going to now talk about some specific metals found in the welding fumes, and there are only few. There are many more which can be present and which are hazardous, but these are the ones which are more commonly found and very hazardous. So we're going to talk about them in the next slides. Next slide, please.
So let's take a look at manganese. Manganese is a neurological and neurobehavioral deficit from low exposures, include changes in mood and short-term memory, altered reaction time, and reduced hand-eye coordination. It would interest you to know that we do need a little bit of manganese. It is part of our vitamin mineral makeup as human beings. However, too much of it, as you can see, can cause problems over long-term exposures. Male workers also have a higher risk of fertility problems. And currently, there is no biological exposure indice for manganese, since the correlation between manganese airborne and urine concentration is weak at the moment. Next, please. So inhaled manganese bypasses the body's defense mechanism. The accumulation causes damage to lungs, liver, kidney, and central nervous system. So it does hit a lot of organs within our body. Chronic high exposure, so greater than 1 milligrams per meter cube, may lead to Parkinsonian syndrome or manganism. So Parkinson-like symptoms may include tremors, slowness of movement, muscle rigidity, and poor balance. So all not natural to human beings because of the exposure to manganese. Next. So exposures below occupational exposure limits can also affect the nervous system and result in Parkinson-like conditions. So this is a quite worrisome. We need to fight to make sure that the exposure levels we're requesting several boards or agencies to lower them to a point where we don't have any symptoms or health effects. NIOSH, the National Institute for Occupational Safety and Health, states recent studies indicate neurological and neurobehavioral deficits may occur when workers are exposed to low levels of manganese, less than 0.2 milligrams per meter cubed of air in welding fumes. These effects include changes in mood and short-term memory, altered reaction time, and reduced hand-eye coordination. So more studies need to be conducted to figure out what levels are safe, if any, to this particular contaminant. Next. Masood.
Yeah, thanks. So chromium exists in 3 different forms in the occupational exposures, but the one which we are interested in and the one which is known to cause cancer is hexavalent chromium. So chromium 6. It gets converted in when it is inhaled, it goes in the body and again converts back into 3. But we are looking at the chromium 6, hexavalent chromium. We inhale it and we also ingest it through our diet and water, and hand-to-mouth coordination. But from occupational standpoint, the main exposure is through the inhalation of fumes. Next slide, please. So chromium can have an irritative effect on our respiratory tract. The symptoms which can be seen from the irritation caused by chromium are runny nose, shortness of breath, coughing, and wheezing. It can also cause nasal perforation and ulceration from heavy exposure, especially seen in refineries and in a chromium coating manufacturing processes. It can also cause bronchitis, decreased pulmonary function like COPD. It is also a sensitizer for asthma, and it can also cause lung cancer from chronic exposure. It is also can cause skin sensitization and allergic reactions upon exposure. Next slide, please. So most chromium is either absorbed by the lung or gastrointestinal tract with some skin absorption. So it's not really readily absorbed through skin, and the ingestion is very low when we talk about occupational exposure. So as I said before, it gets absorbed in the body and turns back into chromium 3, but we can only measure chromium 6 because that's more relevant to the adverse health effects. It has a short half-life, so mainly since it's water soluble, so its half-life is short, but it really depends where it is stored in the body. We have 3 compartments in the body, like our organs, fatty tissues, and the blood circulation. So if it's in the fatty tissues or in the bones, it can stay for longer in the body, but mainly since it's water soluble, it has a short life. It gets cleared from our body within 15 to 41 hours. Next slide, please. So what one can do a blood analysis or a urine analysis to look for how much chromium has been absorbed in the body. And one can go to a lab and get the blood work. They do total chromium, and they can also do different levels of chromium, like chromium 6 and chromium 3 trivalent chromium. The cost was $40 for the blood analysis a few years ago. I don't know the cost now, just to give you an idea. One can also do urine analysis, but the thing is, if you go to a lab and do the test, they will compare your results with the general population chromium levels, which would of course be lower than the welders, the working population. So a better comparison would be to compare the results with the biological exposure indices, which are developed for the workers. So the chromium levels should be compared to the chromium levels of the working population. So the sample should be collected at the end of the shift, and the BEI for it is 25 micrograms per liter, and it can also be collected before shift and at the end of the shift to increase to check what's the increase in the absorption of the chromium. The tests are not covered by OHIP. There's a cost to it, just to let you know. Next slide, please. Chromium levels in the body or the absorption of chromium in the body can be affected by physical activity, how one is physically active, because if you are physically active, the whole distribution, absorption, and elimination of the chromium can be affected, or I would say if one is in a good physical condition, the elimination will be improved. It also depends on what sort of diet you're taking. Certain diets like canned food or certain fish has high level of chromium. And of course, smoking is also one of the sources of non-occupational exposure of chromium. Next slide. So the big question is, what is a normal chromium level? So as I said before, if you are occupationally exposed to chromium, you will have higher levels of chromium in the body as compared to the general population. So to get a better idea about the levels in the body and the exposure level, one should compare the results with the BEI, and there is no particular treatment for it. The only treatment would be to stop the exposure and let it eliminate from the body. Since it's a short half-life, it should be eliminated from the body fairly quickly. Next slide. So keeping all those things in mind, should we actually test for chromium to see if the chromium is going to develop a particular, health problem or not? The answer is, I guess, that's not the idea of doing or checking chromium in the body. The main purpose of checking chromium in the body is to see how one is been exposed to, if the controls are working or not, if the respirator been given to a welder is been protective enough or not, or other controls like local exhaust ventilation and whatnot, are they reducing the level of chromium in the air enough or not? That can be told by the levels of chromium in the blood, but it cannot really predict a disease. So should we test for the chromium or not? Yes, it depends what you are looking for. Next slide. So nickel is another very hazardous metal in the soup of welding fumes. The adverse health effects depends on the solubility or bioavailability of the nickel compound. The health effects from nickel exposure are mainly chronic irritation, inflammation, and cancer of the respiratory system, and allergic contact dermatitis. Next slide, please. So to understand the toxicity of the nickel, it is important to know what kind of or what different species of nickel are soluble or insoluble. So soluble nickel compounds are nickel salts such as chloride, carbonate, sulfate, carboxylate, and hydroxide, and these compounds are commonly used in electroplating. The ones which is found in the welding fumes are nickel oxides, and they are poorly soluble. Or in other words, we can say when they are absorbed in the lungs, they stay in the lungs and do the damage locally in the lungs. Next slide, please. Nickel is mainly absorbed in the body through inhalation, but it can also be ingested at the workplace from accidental hand to mouth coordination. It can not readily absorb through the skin, but can be absorbed through the skin and cause local effect, not a systemic effect. It is distributed in the body through the first pass effects and gets eliminated through urine. Next slide, please. So nickel's biological exposure indices is for elemental nickel and poorly soluble nickel, which is 5 micrograms per liter. BEI for soluble nickel compound is 30 micrograms per liter, which is like in the welding fumes, it will be a mix of soluble and insoluble nickel, but it is, dominated by poorly soluble nickel. So, and it is lower than the soluble nickel compound BEI. So it's better to use the 5 microgram per liter. So urine sample should be collected post shift at the end of the work week. Next slide. Over to you, Sonia.
Thank you, Masood. Very briefly, with regards to iron oxides, as we know, this is a major contaminant in all iron and steel welding processes. And right now, iron oxides are not classified as to their carcinogenicity today anyways. But if there is exposure, metal fume fever is what the exposure effects are. So this would include like flu-like illness, chest tightness, cough, fever, and just general malaise and lethargy. Siderosis is also an outcome, a benign form of lung disease caused by particles deposited in the lungs. Because of their size, they were able to get into the lungs. Acute symptoms include irritation of the nose and lungs, and it tends to clear up when exposure stops. So, and next, please. The next item is beryllium. Beryllium is, in fact, also cause for metal fume fever, and it is a confirmed carcinogen as well, IARC group 1. The other thing with beryllium, as mentioned by NIOSH, is that workers exposed to particles, fumes, mists, and solutions from beryllium-containing materials may develop beryllium sensitization or chronic beryllium disease, which is pretty disabling or even fatal when it's a respiratory disease. And again, depending on how workers are exposed, the diseases can affect different tissues and organs, a little bit like manganese that we spoke about earlier. So breathing in fumes or dusts of beryllium may injure the lungs, while most commonly associated with diseases of the lungs, beryllium may also affect organs such as the liver, kidneys, heart, nervous system, and the lymphatic system. And as mentioned already, it's also a skin sensitizer. So we need to be worried about exposure to beryllium, as well as all the other items we've talked about today, and some which we haven't covered today in this webinar. Next, please.
So can I add something to
Sure.
the beryllium, if you don't mind? What's make this beryllium more hazardous and more tricky to control is that it can cause these adverse health effects like sensitization and carcinogenic effect at a very, very low level. The exposure limit is, I think, is like 4 decimals, 0.000 something. So you have to have a very robust control system to manage beryllium exposure. Just wanted to make this point. Thanks. Over to you, James.
All right. Thank you, Masood and Sonia. So the next section, I'm going to talk about welding exposure prevention strategies. So here is our triangle with increasing effectiveness or increasing priority as you go up the triangle. So at the top there, we have elimination or substitution. Then we have engineering controls, then administrative and work practice controls. And our least preferred method of controlling exposures is personal protective equipment. However, that's often thought of first when controlling exposures. So just some different exposure limits. So if you look at the first one there, hex chrome, different organizations publish different exposure limits. Ministry of Labor here in Ontario, 0.01. The American Conference of Governmental Industrial Hygienists, so they're 0.0002. The OSHA PL is 0.005. And NIOSH, which was mentioned earlier in this presentation, they have recommended exposure limits, and it looks like theirs matches the ACGIH. So we have several examples here. OCAL does recommend 0.1 milligram per meter cube as total welding fumes to protect against carcinogenic effects. So when we talk about a prevention program, we're going to talk about engineering controls, PPE, and medical surveillance. And so, you know, I get a lot of questions about, you know, or phone calls about, you know, we have this group of workers welding. What do we need to do? Well, as we found out through this presentation, there isn't one easy answer. As Sonia mentioned, you know, the exposures are a chemical soup of particles and gases, and they're very complex. So there's not always an easy answer. So one of the first things that we can do is, you know, increase ventilation. So here we have mechanical or general ventilation. So in this diagram here, we have the air being forced out of the work area and away from the worker. So the welding fumes are being captured and pushed away from the worker, so away from his breathing zone. And here we have our local exhaust ventilation, or what we like to refer to as LEV. So we have several examples here. Looks like this one on the left here is a movable hose. So this can be moved right to where you're producing the welding fumes. And then right next to it is an example, like you have the hose, you have the duct, you have the hood right where the fumes are being generated to capture them. And then over on the right, we have a welding table. So that's probably going to draw the fumes downwards and away from the worker. So when we talk about local exhaust ventilation, there are certain things we have to consider, which is distance from the arc. So if you look at the welder, he's bent over, he's fairly close to where the arc is for the weld. So they need to be able to see what they're doing, which often requires them to be close to the welding producing area. Capture velocity. So you can see on the right here, the hood is capturing the welding fumes. And so you need to be drawing in enough air to capture those particles as they're being generated outside that ductwork. And then the overall design of the exhaust hood. There's several different types of designs. We're not going to get into this presentation, but there is different hood designs for optimal capture velocities. And the next one is level of enclosure. So this one here, there isn't really an enclosure. It's hard to enclose welding processes sometimes because of the visual requirements. And then we have equipment maintenance, maintaining those local exhaust ventilations, making sure they're operating properly, and they have always maintaining they have that capture velocity. And of course, last but not least, something we always talk about at OCAL is training the workers on how to use them, when to use them, and making sure they know how to operate the systems. It's very important because if they don't, then they won't be used. So some other variables here, we have arc length, we have the voltage or current, again, the base metal. This is what Sonia and Masood talked about. The base metal is going to determine a lot of times what the exposures are, the actual welding wire, the base metal surface, and as I mentioned, your posture and techniques. Sometimes you have to get closer to the source of the fumes. All right, so we have 3 pictures here. So you can see this guy on the left, he's very close to this welding process. And in the middle here, we have another welding machine. And then on the right, we have another worker, he's welding stainless steel. Again, very close to the welding process, and you can see there's a lot of welding fumes generated from that process there. And last but not least, personal protective equipment. This includes all things such as hearing protection devices, eyeglasses, gloves, safety boots. More specifically, when we talk about welding fumes, we're talking about respirators. So this is an example here of a powered air purifying respirator, and this would be specific for welding fumes. So again, personal protective equipment, and this is talking about powered air purifying respirators and N95s, saying they can be effective in reducing welding fume exposure, but they can be difficult to use in confined spaces. So you can see the diagram on the right. With the powered air purifying respirator, the contaminants are decreased as compared to without the powered air purifying respirator. All right, so recent studies have shown that only marginal reduction of welding fumes from welding helmet, and the reduction factors vary due to different factors such as level of exposure, position of the welder, and the type of welding. So we're just going to talk a little bit about ventilation and enclosures. So this chart indicates whether a local exhaust ventilation is present and if it's in a confined space. And the next thing is sampling behind the helmet. Whenever sampling is done for welding fumes, yes, it should be done behind the helmet because you're going to get the most accurate exposure levels there. So if there's no local exhaust and it's in a confined space and it was sampled behind the helmet in the third column, that's yes or no. For the first example, we have no, and we're looking at a time-weighted average of looks like 9.96. So if we pick another one, maybe the fourth one down, so no local exhaust, no confined space, sampled behind the helmet, we have a much lower TWA of 2.4. And the CSA does have a standard Z94.4-11, and this is for the selection, care, and use of respirators. It can assist you when selecting respirators for specific tasks and specific contaminants that are in the air. And there's also something called assigned protection factors, or APF for short. If we go down the list, if you think of the half mask or dust mask type of respirator, they have a protection factor of 10. And going down the list, so as I mentioned, powered air purifying, those ones give you about 25. Full face applied air, about 1,000. And right at the bottom, we have full face piece self-contained breathing apparatus, or SCABA, and that would be about 10,000 for your protection factor. And as far as fit testing goes, most respirators require fit testing. This to make sure they fit properly and they're used properly and you're trained on the care and maintenance. So it's only not required for the powered air purifying respirators because those are loose fitting and they supply air to you. So you're not filtering out the air. All right, so there is some calculations. We won't get into too much detail, but the required protection factor, there's some calculations you can do based on if you know the exposure concentration divided by the exposure limit. You'll know what kind of protection factor you'll need. And OSHA also has a respiratory selection e-tool. OSHA is the Occupational Health and Safety Administration from the states, and they can have an online tool that can help you select respirators. Again, based on what your exposures are and the specific contaminants you're looking to filter out. And here's another welding fume control selector tool. This is from the Breathe Freely Welding Fume Control site, and it's a useful tool, and it's very specific for welding fumes. All right, I'm going to pass it over to Sonia to finish off the last couple slides.
Thank you to all our listeners. Thank you for being here with us, listening to this webinar on welding and if there are hazards associated with welding. If you do have any questions, our contact information is as listed on the slide. Next slide, please. And we have started to do podcasts on several topics under the sun with regards to occupational health, ergonomics, etc. So if you have any topics that you want us to cover, please do let us know. You can find our podcast on our website at www.ohcow.ca, or you can also find us on Apple Podcasts. Please do leave us a review so other folks can find us and be privy to the information that we're trying to get out there for the prevention of exposures and hazards in the workplace. Thank you again for listening. Bye for now, folks.